This is Chastity, and she is doing a skills demonstration video on IV insertion.
First, verify the physician's orders. Checking the MAR. Second, collect your needed supplies. IV tubing kit, bag, extra cath lines, and starter kit, gloves. Third, assess for allergies. Okay, he has no known allergies. 4, wash hands. 5, open the outer covering and check the solution. The 5 writes expiration dates, color, clarity, and leaks. Alright. 6, open the infusion set, maintaining sterility. Place roller clamp 2 inches below the drip chamber and close the roller clamp. Remove the protective covering from the spike end of the tubing. Insert the spike into the port of the bag, holding the neck of the port firmly to prevent slipping and possible contamination. Prime the drip chamber until it is 1/3 to halfway full. Prime the tubing, loosen but do not remove the protective cap at the end of the tubing. Unclamp the roller clamp and let the fluid run slowly until it fills the tubing and all the air bubbles have been expelled. Gather your supplies, your start kit, your prepared IV solution, towel, catheters, infusion pumps, and proceed to the client's room and identify the client. Mr. Smith, we're going to do your IV today. Wash hands. Select a vein. Apply the tourniquet 4 to 6 inches above the intended insertion site. Check for radial pulse. Palpate the vein. Release the tourniquet. Using the ChloraPrep and the start kit cleans the site in a back and forth motion for 30 seconds to a diameter of 3 inches. Allow to dry. Prepare the supplies. Tear the tape, spin the IV catheter, place the connection end of the IV tubing within easy reach, loosen the protective cap. apply clean gloves. Reapply the tourniquet 4 to 5 inches above the intended insertion site and check for a radial pulse. Anchor the vein using a non-dominant hand. Hold the translucent safety barrel with your thumb and index finger of the dominant hand. Warn the client of a sharp, quick stick. With the bevel up, enter the skin at a 10 to 30 degree angle.
You can have a sharp stick.
When you visualize blood flashback behind the white activation button, lower the angle almost parallel to the skin and advance the entire unit at an additional 1/8 to 1/4 inch farther into the vein. Using the thumb of your non-dominant hand on the push-off tab located on the colored hub, advance the catheter off the needle and completely into the vein. While holding the needle unit securely, release the tourniquet. Avoiding touch contamination of the insertion site and the tubing connection site, using the third finger of the non-dominant hand to apply distal pressure to the vein proximal to the prepped area directly above the catheter, and stabilize the hub with the index finger of the non-dominant hand. Holding the needle unit straight, use the index finger of the dominant hand to press the white activation button located on the top of the flashback chamber to initiate needle retraction. Securely connect the IV administration set. Do not touch the point of entry of the needle adapter. Slowly open the roller clamp to establish patency. Then reduce the flow rate to keep the vein open. Apply a single 1/2 inch piece of tape across the catheter hub to cover the wings. Apply transparent dressing to the proximal edge of the tape, securing the catheter. Label the insertion site with date, time, initials, and catheter size. Set the flow rate within 2 drops of the ordered rate. Dispose of the needle in the sharps container and discard your supplies. Remove gloves and